Hello, my name's Laura Busfield. I'm the Services Director at Renaisi. I'm going to talk to you a bit today about some of the learnings from the actual operational delivery of one of our programs called RISE, and Alice will be talking you through some of the learnings from our evaluation as well. So for those of you that don't know, RISE stands for Refugees into Sustainable Employment. It's a contract on behalf of the Big Lottery and the European Social Fund as part of their Building Better Opportunities programs. And it's specifically designed to support refugees across 10 boroughs in North and East London. As John mentioned before, in terms of significance, this is our first one as a prime contract holder. It's our first contract working across such a big geography, our first time managing a supply chain, and also first time working exclusively with refugees. So just to give a bit of context, we've registered 561 refugees onto the programme, supported 122 to find employment, and as it stands right now, we've helped 52 refugees to remain in employment at 6 months or more, and we're still counting that. Just to also mention that what I like about this programme is that we're encouraged to measure other soft outcomes that you aren't necessarily able to do on other programmes. And I think in a world where payment by results and the success of a programme is judged on the maybe 40 to 50% of people that you get into work, I think it's really important that the Big Lottery are recognising other really great achievements that you achieve for those people that don't go into employment. So in terms of our programme design, one of the biggest challenges and changes that we've made has been to our training offer. We came in with a model of training based on ESOL, social wellbeing activities, basic IT, and we've had to constantly adapt and evolve that. One of the real challenges, as I'm sure you can appreciate, is attendance rates. Anyone that's ever delivered this type of programme. We expected a dropout in terms of attendance rates, but we've probably been experiencing consistently around 50 to 60% dropout rate. So we really started to ask the question, well, why is that? Is it that what we're putting on, is it relevant? Are we not selling it properly? Are we not reminding people? And actually, after feedback from the advisors and some of the refugees themselves, a lot of it was around this, and it was people coming with a mentality that they just want to find a job, particularly if you don't have recourse to public funds, you don't have a way of supporting yourself or your family. You don't necessarily want to sit down and have a conversation about what your barriers are and how we can address them, or how a confidence building course can help you find work. Actually, they're just wanting to go into work, especially with the young men that we're coming across as well. And actually, this has led to another challenge, which is people going into low paid, low skilled jobs when they're actually really highly qualified. This has been another issue. So as you expect as well, we've had a number of people come to us that have been through traumatic experiences, suffering from anxiety and depression, but actually just broaching the subject with some cultures around well-being, people don't often understand what the term is. So I think caseworkers have found it really, really difficult to try and sell the benefits of addressing issues of well-being and how that can help you in the future find sustainable employment. And that's actually led to some of the lowest attendance on our courses. We've tried arts and crafts, we've tried yoga, we've tried absolutely everything, and still we have a problem with trying to engage people onto wellbeing programs. And also there's a issue of homelessness. Again, we knew it would be an issue, but I think we grossly underestimated the scale of the issue. Around about 40% of participants we've engaged with declare themselves as homeless, around another 20% of those are living in hostels. So it stands to reason that if you are not in stable housing, then actually attending a course to learn new skills is probably quite low down on your priority list. So they've all contributed to the attendance rates on our training. So we've made a number of different changes. Just wanted to talk you through a few, and this was one that just seems so obvious and so simple. We've incorporated employability elements into every course, but actually that hasn't really involved changing the course content too much. Actually, just by adding 2 words, for work, at the end of a title of a programme has had real significant impact. So now you might expect to attend confidence building for work, or basic IT for work, and actually that's really increased the attendance on our programmes because people can see how that can support them find work. An example of what's worked really well is once a quarter through Volunteering Matters, we have Deloitte deliver one-to-one employability days with our refugees. They're paired one-to-one, they go through things like CV writing, interview techniques, applying for jobs, all things that we do ourselves at Renaisi, and yet every time we're putting on these courses, you get 15 to 20 people attending, feedback's always been really positive. And again, we started asking, well, what is it about these Deloitte days that they're so more appealing than some of the stuff that we're doing? And actually what it boiled down to, I originally thought maybe it was the Deloitte brand. People thought they were going to get a job at Deloitte. But actually when you speak to people, the refugees don't necessarily know who Deloitte are. And what it boiled down to really was, it was run by an employer. And I think that begs the question for us is how can we more meaningfully engage employers into the main delivery of programs and not just as an end result, as an end product. So you would expect that language would be a barrier to employment when delivering a program to refugees, which it definitely has been. We originally partnered with Redbridge Institute to deliver ESOL training, classroom-based ESOL training based on a scheme of work. And actually the formal approach didn't work, and it came down to this again, low attendance. So when we started to look at that and started to get feedback from the tutors, a lot of the feedback was around this, and it's the different variations of language spoken in one room made it very, very difficult to teach. It made it very difficult for those at the lower end to get the one-to-one support that they needed. We have many people that are kind of level 2, but then we have many people that aren't able to read and write in their own language, which makes learning English even harder. So we've made a number of different changes to our ESOL provision as well. We've taken a less formal approach, and we're not trying to replace formal ESOL at all. We'll happily signpost people to that. But actually we've moved on to more conversation clubs, more informal conversation clubs that are delivered across the 10 boroughs. And what we do is we ask participants to choose the content of those conversation clubs. They've been really well attended so far. Some of the topics chosen are how to access services such as healthcare, GPs. Passing the Life in the UK test has been a really popular one. And we've moved to a more one-to-one tailored ESOL support. So we now have, I think, around 5 or 6 ESOL tutors that work across the 10 boroughs that provide the much needed one-to-one ESOL support. And again, it's not necessarily teaching them about how to say the cat's out on the mat. It's about teaching people things that are relevant to them in their life right now. So helping them fill out forms, helping them to access services, etc., etc. And all of this, and it seems very, very obvious, but all of this is really about listening to the needs of the caseload and making sure that you're flexible and adaptable, and you can respond quite quickly to the changing needs of the caseload. And I think we've always done that, but probably not as quickly as we have done on this programme. And the change in the kind of engagement levels and the outcomes and the impact of that has been quite significant. So as I mentioned before, this is our first time managing a supply chain, working with really, really small organisations in partnership to deliver one common goal. And there's been a number of opportunities from that. It's been a really good learning experience for us. Co-location has been one of the biggest ones. We only have an office in Hackney. Well, we've got two in Hackney, one in Haggerston, one here. We can't physically deliver in the local areas without premises. So just being able to deliver a good quality service in partnership with a number of organisations in the local area has massively boosted the attendance rates in particular areas. It's also helped the working relationship between the Renaisi employee and our partners as well, so we can have a much more open dialogue. We're addressing issues there and then on the spot in partnership with each other. And as well as our formal partners, we have 9 partners, mixture of referral, delivery and strategic partners. We've engaged with a number of different non-formal partners. So our partnerships manager, Emma, I don't think she's here, but her role is to look at what we're providing, look at the needs of the caseload and go out and find other organisations that could add value to the service. One really good example of that has been the YMCAs. So we started in YMCA Walthamstow. They had a number of refugees within their properties. So they would refer refugees to us, but also we would cross-refer into them for refugees that needed supported housing. Off the back of that, we're now working out of 4 YMCAs across the 10 boroughs as well, so that's been really positive. And finally, capacity building. It's been really great to be able to work with smaller organisations to give them an insight into this type of employability programme, give them the opportunity to engage in this type of employability programme, provide them with more skills and knowledge, particularly around ESF. But also, on the flip side, we've learned a lot from these organisations, these really specialist local organisations. One example is Anne Thomas from Mind has spent the best part of 18 months upskilling our advisors on mental health first aid, on trauma, on PTSD, on providing one-to-one support to our advisors and participants around overcoming some of those barriers. And just, hang on, bear with. There's been some challenges also working in partnership, and I'm sure anyone who's delivering BVO now is going to appreciate my next point. As I say, we work with really small organisations, and I don't think anyone really understood at the start of Building Better Opportunities the complexity of the claims process. And if you're a small organisation that's never dealt with ESF before, and then suddenly you're having to evidence every penny that you spend, quite often some of the funding that they receive is disproportionate to the amount of time they have to put in to submit these claims, and that's been a real challenge for us, and we've tried to support where we can, but it has been an ongoing challenge. Thanks, Scott. And that goes down to resources as well. So I absolutely believe that we need to engage these local organisations, particularly when we're talking about referral partners. They're the ones that know their area the best, they have the reach within the communities, but actually, particularly when dealing with refugees, it takes a long time to build up trust. So if you've got a team of 4 people, one goes on long-term sick and one's on annual leave, actually there can be quite a long period of a gap in the service, and it takes a lot of time to build up that momentum, which can lead to some performance issues as well. So just when we talk about Renaisi's strategy and what does it take to improve a place, what I'm really interested in at the moment is not necessarily what we can do as an organisation to do direct delivery. I think we've been doing that for a long time. We know what we're doing, we're still learning. But actually it's how can we support other organisations in the areas that we're working with to also be able to improve their services for refugees as well. And that's it from me. I'm going to hand over to Alice.
My name's Alice. I work in Renaisi's consultancy team. And my role in this project is to effectively act as an internal consultant supporting with the evaluation of RISE, which has been a really good opportunity for us to apply some of the skills and knowledge we have in our consultancy team actually in-house on a programme that Renaisi is delivering. So it's been a really interesting experience for both teams, I think, to kind of learn from each other. As you can imagine, for a programme of this nature and scale, we collect an awful lot of data, and the evaluation's been quite wide-ranging in terms of content. But for today, I've selected just a couple of hopefully interesting pieces of data to share with you on 3 questions. So the first one is to give you a bit of a flavour of who these people are who are engaging with this programme. Who are these 561 people that we've engaged so far? I'd also like to share with you a bit of information about the types of jobs that we've supported people into. And very briefly at the end, I want to talk a little bit about some of the other outcomes we've achieved, because as Laura mentioned earlier, it's not just about the jobs, it's also about the other ways in which we support people and the other outcomes we can help them to achieve in their lives. So to start with, who have we engaged? Of the 561 participants, just over half are men. We've got 40% women, and the other percentage of people who didn't want to answer the question or who we don't have data for. But definitely slightly more men on the programme than women at the current time. That's actually improved as the programme has matured. At the early stages, it was more like 70% men, 30% women, but the gap has been narrowing. Looking at the ages of those people, so this graph, we've got younger ages at the top down to older ages at the bottom, for those of you who can't see the numbers. And the men are in purple and the women are in green. And what we found quite interesting with this cohort is actually men tend to be skewed towards younger ages. So we have a higher number of young men, particularly in their 20s or kind of mid-20s, engaging in the programme, whereas women are much more evenly spread across different decades. And on average, women are about 10 years older than the men on the programme, so the average age is about 35. That explains some of the diversity of the programme and also some of the challenges that Laura was talking about earlier. Our participants on the programme also come from a big range of different countries across the world. The highest number of participants from any one country come from Eritrea, so we've currently got 85 people come from Eritrea, which you may not be able to see on the map, but it's the small, intense orange colour just above Somalia in the kind of north and east of Africa there. We've also got a really high number from Sudan, from Somalia, Ethiopia, Iran, Afghanistan. and other areas of kind of southern and central Africa as well. In terms of the boroughs where people live, as Laura mentioned, we deliver across 10 boroughs in North and East London, and you can see those in purple here. But we also cater for people if they live in a different borough but they still want to engage in this programme, that is allowed. So we also have a number of people who are actually living in different boroughs but come to us for support anyway. As you can see, there's quite a wide spread in the number of people we've got from different boroughs. So at the top end, Haringey, we've got over 100 people currently living in Haringey. And at the other end, Enfield, we've only got 13. And I think there's a couple of reasons for that spread. One of the primary reasons is that this is really a reflection of the areas where we've got local partners who are really engaged and really have those networks of refugees and are able to refer them to us. So Laura mentioned the YMCA, for example, and they are the source, if you like, of the majority of people from Haringey and from Waltham Forest, because there's a YMCA in both of those boroughs. So that partly explains this kind of wide range in numbers. Laura mentioned as well some of the challenges we've had with ESOL, and I think this graph really illustrates that. So across the bottom, going from left to right, we have people with lower English levels, so pre-entry on the far left, right through to fluent on the far right. And again, we've got men in purple and women in green. And you can see just how diverse the spread of English levels is across this cohort. Also interesting the fact that we have a much higher proportion of women who are fluent than we do of men. And we think that might be a reflection of the fact we tend to be attracting younger men who've been in the country for a shorter period of time, compared to women who've maybe been in the UK for a longer period of time and are only now kind of thinking about how to, what their route into employment might be. And again, as Laura mentioned, homelessness has been a massive issue, even bigger than we'd expected when we launched the programme. So we've got about 40% of people are homeless, a further 20% living in hostels, and then just under a fifth who are supported in council accommodation, and then a further roughly 20% who are either living with friends and family or living in private rented accommodation. And again, that's created a whole host of challenges for us as an organisation in kind of delivering this programme well. But I guess the more important question is really, who have we not engaged? So how we've used some of this data is to help us really refine our outreach, our approach to outreach, where we do it, who we're doing it with, and trying to make sure that we're not missing people who might really benefit. In terms of the countries that are underrepresented, we have a really good representation from Southern and Sub-Saharan Africa and Eastern Africa, as you saw from the map. There's no kind of concrete data on how many refugees there are in London from different countries or where they live, but we suspect that we are underrepresented in people from Southern Asia, so Pakistan, India, Sri Lanka. Those are countries that historically have had quite a high proportion of refugees coming to the UK, but we haven't seen that high proportion on this programme so far, and we're now starting to work out how we can actually improve our engagement with some of those communities. And the final question is, are women underrepresented on the programme? So we do have a target of 50-50 men and women, but actually when you look at data on refugees in the UK, about 70% of refugees are men and about 30% are women nationally. So actually our kind of 60-40 split at the minute is actually over-representing women compared to the refugee proportion of refugees in the UK at the moment. So moving on to my second question about what types of jobs people are achieving. As Laura mentioned, we've got 121 people in jobs at the moment. 61% of those people are men and 39% are women. So at the current time, we're slightly more successful in placing men than we are with women. And those people are going into a range of different contracts. As you can see, the majority of people have gone into a full-time contract, but they're far more likely to be men than women. Roughly equal proportion of people have gone into part-time, and still quite a high number. A couple of people gone into 0-hour contracts, and at the moment they're more likely to be women than men. And also supported 4 people into self-employment, and all of those 4 people currently are men. So we're keeping an eye on this to kind of understand the more about the type of jobs that we're supporting people into. And these are the top 6 sectors of the jobs that people have gone into so far. It's actually been quite a diverse range, but these are the 6 that have really stood out. So we've got catering and hospitality, warehouse distribution type jobs, customer service, admin, social care, and cleaning. And when we compare this to our other employment programs that are not refugee specific, actually it's very, very similar types of jobs and sectors. So what we found is that the type of jobs that we're supporting refugees into are not hugely different from the type of jobs that we're supporting people from other employment programs into. And of course, there's quite a lot of challenges with this. So one area that we don't collect data on at the minute is the pay of people, of the first job that they take after engaging with this program. So we don't know for certain the types of pay scales that people are on, but looking at the types of jobs, I think it's reasonable to assume that many people will be in lower than average paid jobs. Anecdotally, again, we don't have systematic data on this, but we know that some people are going into jobs for which they're overqualified. There's all sorts of reasons for that, and it's a real issue kind of working with refugees as to how to support them to take jobs that are more aligned with the skills they have from their home country. But as Laura mentioned, a lot of people are just really desperate to get a job, any job, as quickly as possible, and I think that's one of the reasons for that. But again, as I mentioned, the types of jobs people are going into are comparable with our other programs. And then finally, I just want to briefly mention and pick up on a point Laura made about, it's not just about the jobs, it's also about the other outcomes that we support people into. And here's just a few examples of some of those outcomes. This is after just 3 months. So we're really pleased with these figures, showing just how many people have, for example, improved their well-being and resilience, increased their support networks through being on the programme, and increased their skills and knowledge in relation to employment. We do continue to ask that question after 3 months as well, and we've tended to see it does improve consistently over time. So we're really pleased about that, particularly improving the well-being of people who might not be able to get into a job within the timescales of this programme, but for them that's actually a really important outcome of their engagement with us. So I'm going to leave it there. If you've got any questions about the data or anything else about the programme, then do get in touch. We're really happy to share more learning on what we found out through this programme. And thank you for coming today.